Andy Johnson, looking at a series of videos related to individualized education programs, IEPs, as it relates to literacy, specifically students with mild and moderate reading disability and severe reading disabilities known as dyslexia, although we sometimes even wonder in the field if that term even exists. First of all, put yourself in the parent's position. What must it feel like sitting there at that table with all those people around you spouting out letters and acronyms and fancy words? Keep that in mind. The purpose of the IEP is to evaluate students' performance, to examine their unique needs, to see what can we do. These are the people, oftentimes on an IEP meeting. This video lecture is to address just the IEP as it relates to literacy, more specifically dyslexia and reading disabilities. A rule of thumb, however, is do not blather and confuse. It's very easy to write a confusing IEP, one that parents and teachers don't understand, but what's the use? If we're going to write an IEP, let's make it actually useful. We must be able to understand the salient elements. Create something that actually helps students. Well-written IEPs can be very helpful. However, confusing, overworded IEPs can be not. Here's some basic stuff, and we'll be going over each one of these. But the big picture is to determine where the student is at. If you're a student, where are you at? Where do you want to be? What do you need to get there? And this is where many IEPs related to literacy fall far short of the glory. And how do we know when you are there? That is the big picture. So the purpose is to identify students' unique educational needs, the services that need to be there, and how will we determine if the services work. That is the basics. Now, the IE process basically is pretty good. The product is essentially good and helpful. It's when people get involved and make it so confusing and cumbersome and irrelevant, it gets in the way of providing help more than helping to help, if that makes any sense. Basic overview, we'll be going over the parts of an IEP in the next one.